Is everything good? Okay, terrific. Well, good afternoon, everyone. As Jerry said, I'm Constance Nestor, and I am currently the AVP for Facilities Management and Support Services at President's Mercy Medical Center out in Aurora. And some of you, I bet, don't know who President's Health is, but Resurrection Health System and Prevena Health System merged about a year ago and formed President's Health System, and so that's my current employer.
Maybe you speak up a little louder.
You can't hear me. Okay, that's not good. Can you hear me now? Okay. If during the course of my talk, if you can't hear me, just speak right up. Okay. So just currently I'm with Mercy Medical Center, but during my career I've served as a facility manager, if you will, for 4 other organizations. I have a Master of Architecture degree, and I have functioned in architectural firms. I was Senior Vice President for Strategic Advisory Consulting Services at Gresham Smith & Partners and other places, and have led strategic advisory consulting services practices in a few places. Have my own Nestor Associates sideline a little bit on the side. But I'm a green belt, a certified green belt in lead, and during my career I've focused on healthcare by and large since I was quite young. And so some of the analogies and examples that I'm going to present today are from the healthcare environment, but have direct applications to any industry, really. So think about the applications to your industries and business types as we go through some of this. I've been involved with a lot of healthcare projects and have been very active in IFMA, probably more than 15 years, and especially the Healthcare Council, which is now the Healthcare Institute. And so recently, I've played many roles over the years, but currently I agreed to be the Vice President for Research with the Healthcare Institute. And this is purely on a voluntary basis. It comes directly out of my hide. I'm not paid a dime for it, so it's just all for the fun and for the love of the game, as they say. Now, I thought that would just go right down. Let's see here. Oh, okay, good. So just very quickly before we start, just to tell you something about IFMA's Healthcare Institute, our mission includes education, networking, member advocacy, and of course research, which is my interest. And our research projects are intended to be as evidence-based as possible. I'm personally very interested in applied research projects that will benefit our community in facilities management. We collaborate with universities. Currently, we're collaborating with the University of Illinois Urbana-Champaign, the College of Architecture on a couple of things, and we do publish our findings and share our findings with the community. Just to show you an example of our product, this is a benchmarking report that came out this year. It's just loaded up. I know you can't see, but there's lots of graphs and data and so forth in it, ranging from cost comparisons, productivity metrics, staffing comparatives in our industry. So if anybody would like a copy of that and you want to leave me your business card, I'll email you a complimentary copy of the metrics. But of course that's not why I'm here. So let's zero in on talking about the lean performance improvements process. And today I'm just wondering, actually before I start, how many of you in the room have participated in a lean performance improvement process before? One person? A couple of people? Okay, that helps orient me. Well, our agenda for today is to talk about lean and why it is so darn popular in the United States today. We'll look at the theory and the tools. I want to take you through what we call a lean rapid improvement event, because tremendous improvements are made in 3 to 5 days by organizations every week of the world. And so I think that may be of interest to you. So we'll look at that process and those tools. I want to show you some success stories. And the success stories tend to center around the money, either additional revenue hitting that bottom line or cost savings, that kind of thing. For those of you who are in the construction industry, how many in the room in the construction industry? Anybody? Okay, so I have some things on lean construction methodology at the end, and I'd like to engage in some discussion with you, and some of you who have participated, perhaps you'll be prepared to share some of your lessons learned with the group. So the philosophy was developed in Japan and promoted by the Toyota motor industry. You hear a lot about dimming, but it was actually a Japanese gentleman, Taiichi Ono, who I think developed and really expanded the idea of lean. And the key concept in lean is that we want to reduce the waste or rid any process, any system, any business enterprise of all waste. So Toyota's concept was zero waste, zero defects. If you're in the automobile manufacturing industry, getting rid of all the defects on the line is mission critical. The other underlying principle that's very closely related to lean has to do with process redesign. And the thought is there are really no bad people. Virtually everybody is well-intended. So it's really just the processes that are bad and that cause errors sometimes. If we can fix the processes, we can improve performance. So what are some of our goals in the lean process? Well, we want to eliminate all the waste, as I mentioned. Obviously, we intend to improve our efficiencies in our business processes. Quality is always improved, and quality outcomes. A big driver is to lower costs and also to increase revenues. And then if you can do all of this, just as a halo effect, you're going to increase staff pride in your organization. Improvements are guaranteed. I have never participated in one of these projects where improvement didn't occur. So it's like magic, which is why everyone's so excited about it. Now, the Japanese word for waste is muda. And in this process, there are 7 wastes that we try to identify and eliminate from any process. The first being confusion. And oftentimes, confusion results from communication breakdowns or lack of training, for instance. People just simply don't know what to do, and so errors are made. Motion and travel is another thing that we look at, particularly how many unnecessary trips, how many unnecessary steps. I'm in the healthcare business, and so if nurses are supposed to be walking something like 11 miles a day, in some cases just looking for stuff, that's a disaster. And so healthcare has gone after this big time. Waiting is sheer waste. None of us like to wait. If you go to your doctor's office, you don't want to be sitting in there, either in the waiting room or the exam room. And so we want to eliminate all the unproductive time from our processes and activities. Just process glitches in general, mistakes, errors, those need to go. Inventory is another waste. People are, where is it? What is it? Where do we store it? How long does it take to get it? Defects in general, errors. And then overproduction, which is really duplications. Do we have redundancies in our systems? Are we duplicating effort? Is our next door neighbor doing the same thing that we are? And this is just a very simple-minded diagram. But the point I'm going to make with this diagram is that even the simplest processes going, such as just scheduling a conference room for a meeting, can be waste-riddled. And this is showing the secretary on the right who maybe emails the counterpart who knows whether the room is available or not, and misses. And so maybe she telephones the person and gets the voicemail and leaves a voicemail, and then the counterpart who knows whether the room is available or not calls back and misses, and the telephone tag begins, and so forth. You get the idea. Virtually every process can stand improvement, and that's what this is about. So we have some rules to the game. One of our rules has to do with standard work. And, you know, if you think of McDonald's, for instance, or Mrs. Fields Cookies, or even Disney, some of the most successful businesses that we study in our econ classes, in the MBA programs, we're looking for consistent, reliable, high-quality outcomes or services or care or whatever the field is, whatever the output is in your particular business. Your customers come to you, they want that reliability and high quality. They want to know exactly what they're going to get when they come. So standardizing work is very important, having people do the same thing. I can tell you I have had project managers reporting to me several times during my career, and in the construction business, no project manager is doing the process the same way, typically. One person may be managing a project by sitting at their computer and working on schedules, working on budgets, emailing, making telephone calls, and the counterpart managing a similar project may spend all of his time out in the field, walking the construction site and looking for penetrations. So standard work is very important. We need to come up with airtight, best practice processes and then utilize those on a reliable basis. We should take the path of least resistance. And each step in any process should be essential. We don't want the extras, we don't want the waste. It's important that people agree on the processes that you adopt. And, you know, getting them involved in helping to create the processes and retool the processes typically results in that loyalty and buy-in. And of course, improvement is our ultimate goal, getting to zero defects. Now this is just a healthcare example, but just a simple thing like changing a dressing in a hospital has a whole lot of steps. And this is just an example of the necessary steps in changing a bandage so that we maintain sterile field and we don't contaminate the patient and expose the patient to infections. So just an example of steps in a process. Now getting back to the tools and the concepts associated with Lean, we use the Socratic method, and as you know, Socrates asked a lot of questions. He was a very curious philosopher, and he typically was known for saying, why, and drilling way down, and you just ask why at the end of every finding. We're going to talk about that a little bit. Gemba is another word that's employed in the Lean process, and that's the Japanese word for observation. And so as I take you through the steps in a rapid improvement event, you'll see that it's very important to sometimes go out into the field and observe firsthand. Don't just sit back at your desk and think you know what's happening out there. You probably don't. It's important to go out and drill down. And I'll just give you an example of that off the cuff. Just last month I participated in a week-long transport rapid improvement event at Mercy. And the issue was the transporters weren't getting to the inpatient nursing units, picking up the patients, and getting them to surgery or imaging or wherever they were going quickly enough. We have a 14-minute goal for transports, and our average was something like 25 minutes. So it was a problem. Surgery was complaining, imaging was complaining, and the thought was the transporters are goofing off. Where are they? What's the problem? It turned out after we drilled down and really undertook the root cause analysis that it was nursing who was at fault. The patients simply weren't ready when the transporters got up to the floors. The nurses hadn't started the IV, or they hadn't gotten the patient into their robe, or whatever the issues were. So just an example. I'm trying to make the point, you can't always just conclude that you know what the problem is. You really need to diagnose it. The DMAIC is important in Lean. You've got to define the problem, then measure it, analyze it. Ultimately, we're going to come up with an ideal process, and so we're going to improve it, and then control it, which means sustain. You've got to keep it going after you implement it. The rapid improvement events, the RIEs, are sometimes called Kaizen, which is another Japanese word. So if you hear that word, you'll know what that's referring to. And we're going to go through the steps in a minute. But many organizations, virtually all large organizations, have started in-house performance improvement departments, process improvement departments. At Presence Health, we call ours breakthrough improvement. And they often are writing policies nowadays requiring this continuous process improvement to occur across all departments. It's guaranteed to increase your profit margin. In the healthcare business, when a lean initiative is undertaken in the average medical center who has not undertaken it previously, the very first project usually results in $1 million, either $1 million savings or $1 million that hits the bottom line. So, and that's an average. So, there are several steps in the process, but actually I've decided it's very simple when we're looking at, say, a rapid improvement event. And the reason these are popular is because there's a lot of gain in a short period of time. If you can put a team together and dedicate, say, 4.5 days, you'd be surprised what the results are at the end of the week. And so they get in a room and they define the current state. What are we doing now and what's wrong with it? Where are the areas of opportunity? And then move into the future state. What's the ideal way of doing things? And then finally, implementation. And I'm going to take you through this. Now, it's important when you pull a lean team together to make it multidisciplinary. So, for instance, getting back to healthcare again, if we're going to look at fixing processes in the emergency department, we don't want to just pull a group of nursing clinicians and physicians and staff together from the emergency department. It's really important to get the stakeholders involved and others who support. So, for instance, we need the people from critical care, we need people from surgery, people from the inpatient nursing units, people who have some skin in the game. We want to have materials management, dietary, people like that. And then it's always good to get some outside objective folks who don't know a thing about your business, and they often have some very creative ideas and observations. You may hear the concept of 3 Ps. Sometimes rapid improvement events are called 3 Ps, which has to do with first preparing to tackle the problem, and then evaluating, assessing the process, and once you reform the process, then going into production. The key concept in all of this is that you make a quantum leap in improvement. Sometimes big projects can take a year. At Presence, we do 3 a month. We take 1 week each month, and we set up 3 RIEs, and we do this month after month, and we're just improving right and left, all sorts of issues. And so this slide just speaks to the fact that an RIE can be 3 weeks, it can be a year, it can be 3 or 5 days. Transformational learning is usually what's experienced because we have team think. If you get a lot of brain power in the room, you're probably going to get much better results than if just one person sits down and thinks about the problem. It tends to be a very deep personal experience. We have report outs at the end of our IIEs after 4.5 days, and there are always lots of testimonials that come from these. The participants will stand up and say, oh, it was just awesome, and how great the team was, and how they couldn't imagine that so much could come out of an effort like this. You learn by doing, because as we are reinventing the process, part of the activity is actually testing it. So we want to, the transport RIE that I participated in a couple of weeks ago, by day 3, we were implementing our new process out in the field and measuring and seeing how it was doing. So you have to test it out as you go. And then this, tends to, again, achieve the buy-in from the participants. They tend to be loyal to the process if they helped create the solution. So now we're going to focus on the RIE, and I'm going to take you through the steps, current state, future state, and then the implementation. So the first thing we want to do when we start an RIE, probably day 1, is to find what the problems are. So I'm going to use emergency room again as an example because probably most of you have been in an emergency room at some point in your life. Some of the processes that we might look at if we're trying to perfect our emergency room practices are the first, triage. When you walk in the door, somebody wants to know what your symptoms are and what's wrong and why are you there. You're triaged, and you know the idea is to get that patient back to a treatment room and under a physician's care as fast as possible. That's the goal. So we look at the triage process. We might look at the registration process. The process that surrounds ordering lab tests or getting the patient to imaging or even getting the patient admitted up to a bed if they need to be admitted to the hospital. So all that. So when you're doing this back at your business, you need to think about, okay, we're trying to fix something. What are all the processes that are involved with that? And then think about what are the opportunities for improvement. Keep hitting the wrong button. Now this is a kind of a funny diagram, but in a way it's useful. There are many ways to map processes, and I'm going to show you some better diagrams than this in just a minute using post-it notes. But the idea is that you map every step in the process. So this one starts up in the upper right-hand corner, and it's the ED process, emergency department. So you see the unhappy patient either comes in an ambulance or a helicopter. The helicopter and the ambulance are going to telephone ahead to the ER and let them know the patient's coming. Over on the far left, the patient finally gets to the ED, and then they start going through a series of steps. You know, they're triaged, and eventually they get to a room. Then eventually somebody talks to them, and then they get some lab tests, or they're sent for a CAT scan, or whatever it is. Ultimately, they're diagnosed, stabilized, and they're either discharged, or they're admitted to a bed, or they're sent to surgery, or whatever the issue is. So it's a matter of defining all the steps in the process. Early on, we were using whiteboards and trying to map the important processes in the conference room with the use of post-it notes. But the problem with that is it's fixed, and you have to erase it and redraw it. So we discovered very quickly in the industry that if we map the processes using post-it notes, step by step by step, on the walls in the conference room, then when you're reviewing it with one another, if you realize you've left out a step, you can just simply move the post-it notes or add another post-it note. So it works pretty well. These sessions are very interactive. People divide into teams, they get up and they map out different processes on the walls typically. As we're looking at processes, we want to look at the productive time in any process, and then where are the waits? Where is the unproductive time? That's very important. And sometimes we have to get out in the field and clock it. So this table on the screen is an example of just a little tool that can be used to go out and clock times in the observation stage, in the GIMBA stage. And so this was a little chart I put together for one of the projects. Again, this was a transport. We were looking. Actually, this was emergency department to admit time. So from the time the patient arrived at the emergency department to the time they were admitted to a bed up in the hospital should not be more than 3 hours tops nationally as an average. You know, in some hospitals it's 8 hours and so forth. So if it's a very simple matter, it should be an hour in and out. And that's what healthcare providers are working on these days. So we went down and observed, you know, the patient maybe gets to the room and then they wait. And so you get your egg timer and you clock. How long before a physician comes? Physician talks to the patient and leaves, but you heard that they ordered the test. Well, how long is it before anybody comes to do the test? All these waits in between each step are waste, and that's what we want to eliminate in all of these exercises. So in this diagram, it's the same diagram I showed you before. It's a better version of it. The patient going to the emergency department and then getting there and what happens. This time, though, we've gone back, and every time you see a box, that is a productive step in the process. Every time you see the red triangle, that's waits or wasted time in between. And once we looked at what was going on, it turned out that there were 3 inordinately long wait periods in this particular ED process. And so that's where you're seeing those crashes, those storm clouds. And we realized, you know, it's the 80-20 rule. If we could fix those 3 steps, we could dramatically cut the times in the emergency department. So those were the 3 things we decided to focus on. When you're undertaking a process improvement engagement like this, you tend to identify many problems or other challenges within the challenge, kind of projects within the project. And we often have to kind of stop the work, okay, let's go over here and study this and see what's really happening there. And so we tend to undertake root cause analysis. And then eventually we want to get to the future state. Now, and this slide was inserted just to demonstrate that sometimes there are problems within the problems. So you see the 3 little problems at the bottom of the slide that have come out of this discovery. So one of the tools that are used with rapid improvement events are called A3s. And what they are is they're just one-pagers. And everybody is using these A3s in the industry. Toyota came up with it, and the idea is that for any problem you're trying to solve, if you can document it on a single sheet of paper very concisely, then that's the most efficient way to keep a record of the problem and how you solved it. And I'll just keep going over here. So here's a blow-up, an enlargement of an A3, so that I can show you what the pieces and parts are. This is one for an emergency department transport issue. And so the first thing you want to do is document very briefly what is the issue up in the left-hand corner. And then you want to provide a little background information. These tend to get filed in the file cabinet. Maybe a year later you want to pull it out and try to recall what it was you did, or you want to share it with a colleague in another site and show them how you think they can fix their problem. So you want to document everything. You document the current state, which is the little process diagram that you see there, and then what the problem analysis consisted of. So this is getting into those 5 whys. So just to give you an example, you know, the problem is the transporter isn't getting the patient to X-ray quickly enough, and those wait times can result in treatment delays, which can actually result in harm to a patient. So, you know, we take this very seriously in the healthcare industry. So the first why is the transporter taking so long? So in this particular instance, well, it turned out they just were dawdling. Well, so you said, well, why were they dawdling? Well, it turns out that the manager in that department, that position is vacant. And so you say to yourself, well, why? Why is that position vacant for so long? But long story short, you keep working through the whys until you make sure you've gotten to really the root of the problem, and then you fix it. So up on the right-hand side, you map out your future state, kind of the ideal process, how to trim out the fat. There should be some countermeasures. What are the steps you're going to take to eliminate the problem? You need an implementation plan in these things. You know, what are you going to do? Who's going to be accountable? When do these individuals have to have these things done by? And what is the proposed outcome, the projected outcome from each of these? If there are resource requirements, those need to be identified and studied, and then a determination needs to be made as to whether that future state process is actually going to be viable. We tend to have a rule in Lean, and that's you're not allowed to add any FTEs. If you add FTEs, that's going to increase your costs. Actually, usually we're trying to reduce the number of FTEs when we're looking at these processes. It's important that they're tested out, and then you need to have a follow-up plan. How often are you going to do your checks? What's it going to consist of? So that's an A3 tool, and if you participate in these, you'll be using that tool. Many think you could solve any problem just using an A3 form. We use it all the time at Mercy. You have one right there?
No, 10 minutes.
Oh, how, 30?
10.
10 left? Okay, I'm going to have to hurry. Okay, so now we have sunshine and nice pictures here where we've solved all our problems. Just very quickly, oftentimes when you're engaging in process improvement, you find that you're not going to actually be able to get there unless you renovate your facility or make changes to your facilities. So there's a process there too in terms of looking at 7 alternatives to solve the facility design. You know, I think I mentioned I have a Master of Architecture degree, but I have just been amazed at what non-design people can do in a room. And so my thinking, and I try to sell this idea to you, let the users who have to work in the area lay out the space. Cut out a bunch of rooms and spaces and so forth. Let them rearrange them on the table. Let them set up the flows, the proximity and adjacency requirements. Tape it down with Scotch tape after they get through, and you got your schematic to hand off to the architects. It'll cut weeks of waste out of your architectural design process to do this. Just another example, it's a cut and paste. It's a paper dolls. One of the things that's very helpful is looking at flows analysis. We call these spaghetti diagrams. Just to give you an example, if a patient is in an operating room and there's a surgical case being performed, but the circulating nurse doesn't have what the surgeon needs, he says scalpel, and she says, oh no, we used our last scalpel, and she has to run out of the room and down the hall and find one and bring it back. It's how much waste, how many trips, who's going where, and how many times are they leaving the area that they're trying to complete their work in. You redesign the layout and you eliminate those kinds of things. Just more examples of spaghetti diagrams. This is one in a trauma room. Store the supplies that people need right where they work so that they're not always making unnecessary trips. That's an operating room example. You can do it to lay out buildings. You know, you need to look at your flows and proximities and adjacencies of requirements and of departments and so on. Sometimes you have to go out and build mock-ups in the field to prove or to test out ideas. There's a tool called 5 S's. It has to do with organizing your space, usually your storage space. Sort, straighten, shine, standardize, sustain. And just to give you an example of that, you know, the drawer on the left is junky. The drawer on the right has been improved. The storage room on the left is junky, and the storage room on the right, we've even taped out on the floor where things need to be stored. This cuts down a lot of time in searching for things. So we're moving from chaos, we get the vision, we build momentum, and then we execute. Very quickly, just to tell you or show you an example of why this is so popular in the United States. It's the dollars, it's the money. Emergency department example, sometimes patients walk out. They sit in the waiting room too long, they're tired of waiting, and they say to their wife, you know, let's just go down to the hospital down the road and maybe we get faster care there. We call these leaves without being seen. And every time a patient leaves, it's a minimum of $400 in lost revenue per patient. And that doesn't include all the halo effect of the imaging testing and all the other things that occur. So if you're in the healthcare business and you can eliminate, you know, 3 lost patients per day, that's $500,000 in revenue that you're going to capture. If we think about the surgery suite environment, it's by the minute. You know, cases start at 7 a.m., the surgeons may leave at 4 o'clock in the afternoon. If you start 19 minutes late every day, that's lost revenue. It's an average of $90 to $150 per minute in lost revenue for lost time in an operating room. If you multiply that times 8 operating rooms in a facility, and you can add a couple of cases per day, you can increase your annual net revenue by $3 to $5 million. I mean, we're talking big money. And of course, healthcare is not big enterprise. So if you work for truly big enterprise, then there's really big dollars to be had here. There's qualitative benefits and quantitative. I'm not going to dwell on all of this. When would you undertake a lean activity, if you're doing a construction project, before you do your planning, your programming, and your design, you need to undertake a lean process. You don't want to design a facility around old, obsolete ways of doing things. You need to examine your processes, revamp your business model, and after you know where you're headed with your business model, then plan and design your new facility or your renovation to your department. So it needs to be early. We're going to improve quality, we're going to lower costs. You know, we talk about green money versus blue money. What's the dollars that are really going to hit the bottom line versus the qualitative advantages? In healthcare, it's the elimination of medical errors, it's saving lives. Those are more qualitative. They're harder to quantify, although we can quantify those too. You may be wondering what the difference between Lean and Six Sigma is. Very quickly, in my view, Six Sigma is a lot more mathematical. We talk about reducing defects to 3.4 defects per million, and it has to do more with the Toyota motor industry and manufacturing businesses and so forth. There's a lot of math involved. The healthcare industry hasn't typically embraced Six Sigma, although some health systems do use Six Sigma. It tends to be easier, and we get very good results just using the lean process. The construction process has embraced this kind of big time, and some of the concepts that have actually, when we started this, I spoke on this several years ago when it was just in its infancy, but there was an allegation out there that 50% of all steps in a construction process are waste. 50%. And we were looking at what the contractors and subcontractors were supposed to do in the course of a week and how much they really accomplished. There were so many workarounds, and things would go up wrong, they'd have to be taken down. There was a lot of waste in the process. So the idea of lean construction is that you get the whole team assembled early. The architect, the engineer, the general contractor, and the key subs, they're in the room day one with the users, and they're all accountable for the project. They're sharing the risks. You incentivize these teams so that there's financial benefits for everybody, including the owner. Typically, the subcontractors, instead of doing the shop drawings at the end of the process, they're helping the architects design. You can combine, you can collapse schematic design and design development into one short activity, and your shop drawings are already done by the time you get to that point. It's important to keep the owners lean as well, though. So we've created rules such as no deferred approvals. Some of these projects, you have weekly meetings, and anytime you need decisions, the owner has to make the decision before they leave the room. If you need the decision that day, the owner has to make the decision that day, and so the owners have to buy in on this as well. There's reverse project scheduling. You look at your end result on your schedule, and then you back it to out to the beginning. And for instance, you ask yourself, can we have multiple trades in at the same time instead of having trades come in consecutively? To the extent that you can foreshorten your construction schedule, you can usually dramatically reduce your cost. Full-time estimating is very important. I like to do what I call real-time estimating during architectural design. We need to know if we're going over budget. Forget this value engineering process at the end of design. It's waste. And then life cycle costing is very important. And I'm sure all of you are looking at these things, but energy cost savings and selecting the right systems and getting with Energy Star and figuring out how to be energy efficient and sustainable is very, very important. So we're getting to the end here. These anticipated results in lean construction, 0 workarounds is the goal, 0 change orders. I used to be with Northwestern in downtown, and we had one of our projects, we wore buttons that said no change orders. Shorter construction schedules, significant cost savings, and guess what? Satisfied customers and team profitability. Okay, so just in summary, why are we talking about lean? Improvements are guaranteed. We're going to eliminate waste in your processes. It's going to save you tons of money and increase your profitability, we think. If you're a not-for-profit like Mercy is, it'll increase your margin, lower your costs, and ultimately, when people are involved with this, it really does increase staff pride, increase staff retention, and loyalty, we think. So, on that note, I would like to hear from you. I'd like to know if there's any discussion, and those of you who have done this, maybe you can share lessons learned with your colleagues here today. Yes, ma'am.
I was just going to say that our company actually is currently going through this whole process improvement sessions using value stream mapping. Each division's having to do things and spend the time. And initially, everyone was extremely concerned about just how much time it was taking away from, we're like, we're too busy, we're already doing this, we're already doing that, how do we have the time to sit down and do this? But then once everyone got into it, I think they realized there was value in it, that even taking a couple of small steps out of the process can make a big improvement. So I'll just say that it is a time-consuming effort to do it. I'm not sure where the word rapid comes in when you're talking about these changes happening quickly. They don't. It takes a lot of time to figure it out, but definitely something that our staff has embraced, and we're even going down to the individual level now where we each have to come up with a process that we want to try to improve using value stream mapping and other things like this. So it's out there. It's definitely out there.
Great, thank you. Thank you. Yes?
You mentioned, I believe the number 50% waste in construction processes. Do we have a similar statistic for government projects?
Oh. Do we have any government employees? I think that was a rhetorical question. Yes, dear.
I work with Interior Investments for one of the top Herman Miller dealerships. And Herman Miller has a process of training people and implementing product to help streamline a lot of different businesses. And they do work on with the Toyota process in their factories, and they get, I think it was 17,000 Aeron chairs out the door in one day. It was amazing to me how they worked and how clean it was. And they do have the tape on the floor, where the trash is supposed to go, where everything is supposed to go. And it's very, very effective. Nobody's tripping over each other, and there's a lot less steps. They have certain people having the jobs to bring things to the location. It's very amazing. So they do welcome people to Herman Miller. Just let me know if you want to go. But they can come in and help train also. So thank
good.
you.
That's good to know.
Your presentation was very good. Thank you.
Yes, sir.
I have a quick question, and I totally agree with the lean approach and process improvement. Is there's no question that it's valuable and it can improve the return on your investment and your revenue. But what I do, I don't want to say struggle with, but what I question is, I think it's very easy to get the buy-in from the people who actually are part of the process, especially if it's staff members or manufacturing and so on. I think it's more challenging in the business world, and I wonder how that worked with the hospitals, and I'm not sure how involved the doctors were or the highly paid technicians, but I know I'm in the legal industry, and legal is a very different animal, and everything's done by billable hours, and well, wait a minute, if I'm going to spend time on this, I'm not billing, I need to make my hours, I need to, I find that to be potentially a challenge. So can you speak to that?
I would think law, the field of law, this may, forgive me for saying this, apply a little less somehow, because there's almost an incentive. I mean, you're kind of on the meter. Anyway, I shouldn't say that. But let me say this. It's important. I think if it's your process that's being improved and you own it, for instance, if I'm an emergency department physician and I know that harm is coming to patients or there's treatment delays or whatever, because it's so critical. We look at one of the process improvement exercises that I've done in my career is looking at the time to get from the emergency department to the cardiac cath lab, because if a patient comes in with chest pain and they're just about to have an arrest or something, we've got to get them to that cath lab very rapidly and get that balloon, that angioplasty or whatever the procedure is that the physician's going to perform quickly. Because the patient, the worst case scenario is they could expire before you get them there. And so it tends to be that if you're really part of the process and you're really vested in fixing it, you'll make the time. And we do have physicians participate in a number of our RIEs. I think we're always very cognizant of making the best use of physician time. I know in the architectural industry, I typically have, we get the design process far enough along before we bring the physicians in. That way we're making better use of their time. So it's that kind of thoughtfulness. But when you're billing by the hour, it's tougher. I think, I'm asked, as a leader at Mercy, I have to participate in 2 rapid improvement events per year as a requirement. And to me, that's 4.5 days in 1 week. And I can't tell you how challenging that is. And it's harder for me to make the time and be faithful to the process when it's somebody else's department or somebody else's problem that's a little bit remote from my areas of responsibility. It's very hard. And actually, I usually get permission to come and go and so forth. So it is a challenge. But and I would say you have to think about it industry by industry and, see what you think the benefits will be, the monetary benefits and any of the qualitative benefits, and then decide. Yes, ma'am.
I just wanted to say that we use lean process improvement in one of the former companies that I worked for, and I think it kind of goes with what somebody else said previously, but the whole goal is, yes, it takes time up front to invest the time and figure out the process and what the root issue is, but it allows you eventually to work smarter so that you don't have to work harder. So I've seen the benefit on the construction end, working in the construction industry, set it up the right way at the beginning, so you don't have to work so hard to fix it on the end.
Thank you, and I think that's an excellent conclusion to the presentation today. I have my phone number on the screen, and I have some cards. If anybody wants to talk offline, wants some tips, I'll be happy to share any information I have with any of you. So just feel free. Thanks, Jerry.
Very interesting topic. Thank you very much, Constance. And as we do for all of our speakers, the Chicago chapter of IFMA does support the IFMA Foundation in its support of scholarships and for the education of facility managers and those who might be in college in the field. And so we're going to make a $25 donation in your name to the IFMA Foundation. We've raised almost $1,800 for the foundation by doing this. So,
well, thank you.
That concludes the presentation. Make sure you do fill out your the surveys, get your additional IFMA bucks.